Millions of people around the world are treating the wrong problem. They are buying back pain medications, booking physiotherapy appointments, changing mattresses, adjusting their office chairs, and feeling temporary relief only for the pain to return. Again and again. What if the real cause was never their spine at all? What if their back was simply the messenger, and the actual problem was quietly developing in an organ they never even thought to check? The connection between the liver and back pain is one of the most underappreciated and misunderstood links in all of modern medicine. And it is not rare. Studies suggest that a significant percentage of people with chronic mid to upper back pain on the right side have an underlying liver or gallbladder condition that has never been diagnosed, because neither the patient nor their doctor thought to look there. In this video, we are going to explain exactly how the liver causes back pain, how to tell the difference between structural back pain and liver-related back pain, what other signals to look for, and what you can actually do about it. This is information your doctor may not have connected for you. Stay until the end, because at the 8-minute mark, we reveal the specific pattern of back pain that most strongly suggests a liver problem, and what to do if you recognize it in yourself. To understand this connection, you first need to understand where the liver sits in your body and how large it actually is. Most people imagine the liver as a small organ tucked somewhere in the abdomen. The reality is very different. The liver is the largest internal organ in the human body, weighing approximately 1.5 kilograms in a healthy adult. It sits in the upper right quadrant of the abdomen, nestled directly beneath the diaphragm. And here is the critical anatomical fact that makes the liver-back pain connection possible. The liver extends toward the back of the body. Its posterior surface is in close proximity to the muscles and fascia of the mid-back and lower right rib cage. When the liver becomes inflamed, which happens in conditions ranging from fatty liver disease to hepatitis to early-stage liver cancer, it physically expands. It presses against surrounding structures. It irritates the diaphragm. It affects the nerve pathways that share anatomical space with the thoracic spine. The result is pain that feels entirely like a muscular or spinal problem, because it activates the same nerve pathways and produces pain in the same regions. This is called referred pain, and it is extraordinarily common. The phrenic nerve, which runs alongside the liver and connects to the diaphragm, shares pain pathways with the right shoulder, the right side of the mid-back, and the right side of the neck. Liver inflammation can produce pain in all of these areas simultaneously, none of which, on the surface, appears to have anything to do with the liver. The specific pattern of back pain most strongly associated with liver problems has several distinct characteristics that separate it from ordinary muscular or spinal pain. First, the location. Liver-related back pain almost always appears on the right side, specifically in the area between the shoulder blade and the spine, roughly at the level of the middle back. Some people feel it more in the lower right rib cage. It rarely crosses to the left side. Second, the quality. Liver-related pain tends to be dull and achy rather than sharp and sudden. It often feels like a deep internal pressure rather than a surface muscular soreness. It does not worsen significantly with specific movements the way a pulled muscle would. Third, the persistence. This type of pain does not resolve fully with rest, heat, massage, or over-the-counter pain medications. It may temporarily improve, but it returns because the underlying inflammation has not been addressed. Fourth, the timing. Many people notice it is worse after eating, particularly after fatty or rich meals. This is because the liver and gallbladder are most metabolically active after food consumption, and increased activity in an inflamed organ increases the pain signal. Fifth, accompanying symptoms. If your back pain is accompanied by fatigue that sleep does not fix, digestive discomfort. Oh, any yellowing of the skin or eyes, or dark urine. The probability that your liver is involved increases dramatically. If you recognize this pattern, the next step is clear. Request a liver function panel from your doctor. The most common liver condition causing this type of back pain is non-alcoholic fatty liver disease, known as NAFLD. And the statistics are staggering. Current estimates suggest that approximately 25% of the global adult population has some degree of fatty liver disease. In westernized countries with high rates of processed food consumption, that number climbs even higher. The extraordinary thing about NAFLD is how silently it develops. In its early stages, it produces virtually no symptoms. The liver is one of the few organs in the body with no pain receptors in its tissue, meaning the liver itself cannot hurt. Pain only occurs when the liver becomes large enough to press against surrounding structures or when inflammation affects the surrounding capsule and adjacent nerves. This is why most people with NAFLD have no idea they have it. They feel fine. They perhaps notice some fatigue, some digestive heaviness, some mild discomfort in the right side, which they attribute to stress, bad sleep, or aging. Meanwhile, the liver is accumulating fat. The fat is triggering chronic inflammation, and that inflammation is slowly progressing toward a more serious condition, called non-alcoholic steatohepatitis, or NASH, which carries a real risk of progressing to cirrhosis and liver failure. The good news is compelling. Fatty liver disease, unlike many chronic conditions, is significantly reversible in its early stages through targeted dietary and lifestyle changes. The critical variable is knowing it is there. Your back pain may be the first signal your liver has managed to send. Closely related to the liver, both anatomically and functionally, is the gallbladder. The gallbladder sits directly beneath the liver, connected to it by the bile duct. It stores and releases bile, a digestive fluid produced by the liver. And gallbladder problems are extraordinarily common and extraordinarily good at mimicking back pain. Gallstones, which affect approximately 10 to 15% of adults in Western populations, can cause a distinctive pattern of pain known as biliary colic. This pain typically originates in the upper right abdomen and radiates directly through to the right side of the back and right shoulder blade. It is often intense and cramping. It frequently develops within an hour of eating a fatty meal. And because it radiates to the back and shoulder, it is frequently misidentified as musculoskeletal pain. Gallbladder inflammation, cholecystitis, produces more constant pain in the same regions, often accompanied by fever, nausea, and pain that worsens with deep breathing. Critically, neither gallstones nor early gallbladder inflammation will show up on an X-ray. They require an ultrasound to detect. This means that patients who go to a doctor describe right-sided back pain and receive an X-ray showing a normal spine may be sent home with a muscle relaxant, when what they actually needed was an abdominal ultrasound. If your back pain on the right side occurs after meals, radiates to the shoulder, and is accompanied by nausea or digestive discomfort, push specifically for a gallbladder ultrasound. The liver and gallbladder are the most common organ-related causes of back pain, but they are not the only ones. Your kidneys sit in the retroperitoneal space, meaning behind the abdominal cavity on either side of the spine at approximately the level of the lower ribs. Kidney problems, including kidney stones, kidney infections, and kidney disease, commonly produce flank pain. Pain in the sides and lower back that is almost indistinguishable from muscular low back pain. Kidney stone pain is among the most intense pain a human being can experience. It typically begins in the back or flank and radiates toward the groin as the stone moves. It is often accompanied by blood in the urine, nausea, and an urgent need to urinate. Kidney infections produce a deep, aching pain in the lower back on one or both sides, frequently accompanied by fever, chills, and painful urination. The pancreas, positioned behind the stomach, produces pancreatitis, inflammation that causes severe pain in the upper abdomen that radiates directly to the mid-back. This is a well-documented and recognized pattern in medical practice. Spleen enlargement, often from viral infections or blood disorders, produces pain in the upper left abdomen that refers to the left shoulder. The mirror image of what the liver produces on the right. The message here is simple. Back pain that does not fit the expected pattern of spinal or muscular injury deserves a thorough evaluation that includes the organs, not just the spine. If you have recognized any of the patterns we have described today, or if you simply want to protect your liver proactively, and there is every reason to do that, then understanding which foods support liver health is essential. The liver is a remarkable organ. It is one of the only organs in the human body capable of regenerating itself, even from significant damage, provided the damaging factors are removed and the right nutritional environment is provided. Coffee is, perhaps surprisingly, one of the most liver-protective substances known to science. Multiple large-scale studies have found that regular coffee consumption, 2 to 3 cups daily, is associated with significantly lower rates of liver fibrosis, cirrhosis, and liver cancer. The specific compounds responsible appear to be chlorogenic acids and other polyphenols, not caffeine itself. Cruciferous vegetables, broccoli, Brussels sprouts, cabbage, and cauliflower, contain sulforaphane, a compound that activates the liver's detoxification enzyme systems at a genetic level. These are not gentle supportive foods. They are actively therapeutic for the liver. Olive oil reduces liver fat accumulation and improves insulin sensitivity in liver cells. Walnuts provide the omega-3 fatty acids and antioxidants that reduce hepatic inflammation. Berries, blueberries, raspberries, cranberries are exceptionally rich in anthocyanins, which have been shown to reduce liver enzyme levels and protect against fibrosis. Garlic activates liver enzymes responsible for flushing out toxins, and provides selenium, a mineral that protects liver cells from oxidative damage. These are not supplements. They are foods, and they are available in every supermarket. Understanding what protects the liver is only half the equation. The other half, perhaps the more urgent half, is understanding what damages it silently, in ways most people never suspect. The most obvious is alcohol. But the more insidious liver destroyers are the ones disguised as harmless everyday habits. Fructose, particularly high fructose corn syrup found in most processed foods. Soft drinks, fruit juices, and even foods marketed as healthy is metabolized almost exclusively by the liver. Unlike glucose, which is distributed to every cell in the body, fructose arrives at the liver in large quantities and must be processed there. Excessive fructose consumption drives fat accumulation in liver cells with remarkable efficiency. It is, in fact, one of the primary drivers of the non-alcoholic fatty liver epidemic. Trans fats, which persist in many packaged foods, baked goods, and fried foods, despite years of regulatory pressure, directly cause liver cell inflammation. Even small, consistent amounts, consumed daily, accumulate in their damage over months and years. Certain medications, most notably acetaminophen, known as paracetamol in many countries, are among the leading causes of acute liver failure worldwide when taken in excess or combined with alcohol. Many people take acetaminophen daily for back pain, headaches, or joint pain, without realizing they are simultaneously stressing the very organ that may be contributing to their discomfort. Chronic sleep deprivation disrupts the liver's overnight repair and detoxification cycles. Research has shown that even 5 nights of insufficient sleep measurably elevates liver inflammation markers. The liver works hardest while you sleep. If you deprive it of sleep consistently, it cannot do its job. If you have watched this video and recognized yourself in any of these descriptions, The right-sided back pain, the fatigue, the digestive discomfort, the pain after meals. Your next step is a conversation with a healthcare provider. But that conversation will go significantly better if you know exactly what to ask for. Request a liver function panel. This is a blood test that measures the levels of liver enzymes, specifically ALT, AST, GGT, and ALP, in your bloodstream. Elevated enzyme levels indicate that liver cells are being damaged and releasing their contents into the blood. This is a direct measure of ongoing liver injury. Request a lipid panel simultaneously. High triglycerides are one of the strongest blood markers associated with fatty liver disease. If your triglycerides are elevated, your liver almost certainly has some degree of fat accumulation. Ask specifically about a liver ultrasound if your enzyme levels are elevated, or if your symptoms are consistent with what we have described. Ultrasound is inexpensive, non-invasive, and can directly visualize liver size, texture, and the presence of fatty infiltration. Mention the specific nature of your back pain, its location, its character, its relationship to meals, and any accompanying symptoms. Do not let the conversation stay focused only on the spine. Push for a full picture. Advocate for yourself clearly and specifically. Doctors see dozens of patients daily. The more precisely you describe your experience, the more likely you are to receive a targeted evaluation rather than a generic one. You know your body. Speak up for it. We have covered a tremendous amount of ground in this video. We have explained the anatomy of how the liver produces back pain, the specific pattern to recognize, the conditions most likely to be responsible, the foods that protect and destroy your liver, and how to have a productive medical conversation. But knowledge without action produces nothing. So let us make this simple and concrete. The most important thing you can do today, right now before this video ends, is this. Check in with your body honestly. Have you been dismissing right-sided back pain as just a muscle problem? Have you been attributing persistent fatigue to stress or poor sleep without investigating further? Has your digestion been consistently uncomfortable after meals? Have you noticed any yellowing, however faint, in your eyes or skin? These are not trivial observations. These are signals. And the extraordinary thing about the liver, unlike many other organs, is that it responds. When you remove the factors that damage it and provide the environment it needs to repair, it actually does repair. The liver regenerates. It has done so for every single day of your life. Give it the conditions it needs and it will continue. The back pain that drove you to watch this video may be the best thing that ever happened to you. Not because pain is good, but because it made you look. It made you question. It brought you here. Now take what you have learned and act on it. Share this video with someone whose back pain has always seemed mysterious. You may have just found the answer they have been looking for. Has your digestion been consistently uncomfortable after meals? Have you noticed any yellowing, however faint, in your eyes or skin? These are not trivial observations. These are signals. And the extraordinary thing about the liver, unlike many other organs, is that it responds. When you remove the factors that damage it and provide the environment it needs to repair, it actually does repair. The liver regenerates. It has done so for every single day of your life. Give it the conditions it needs, and it will continue. The back pain that drove you to watch this video may be the best thing that ever happened to you. Not because pain is good, but because it made you look. It made you question. It brought you here. Now take what you have learned and act on it. Share this video with someone whose back pain has always seemed mysterious. You may have just found the answer they have been looking for.